Hello, my name is Austin Schleight. This is my second attempt for my NR302 checkoffs. Here is my ID card, my 3x5 note card, both sides. Okay, this is my patient. Can you state your name, age, and consent that you are being recorded?
My name is Frank Schleight. I'm 56 years old and I consent to being recorded.
Okay. Let's begin with the assessment. Hello, my name is Austin. I'll be your nurse today. I'm just coming in to do a quick exam and ask you a couple questions. Should take about 15 minutes if that's okay.
That'd be fine.
Thank you. Alright, so I would be doing hand hygiene right now. At this point in time, I would raise the bed. Body symmetry looks good, no fidgeting. Patient looks calm. Clothes are clean and appropriate for the situation. No physical deformities noted. Nutritional status looks good. Can I get your name and date of birth, please, real quick, while I
Yes.
check it with your
Frank Schleight, 9/26/1963.
Thank you. Skin temperature is normal. No obvious lesions on the skin. Why are we here today?
To do an assessment.
Okay. Hold on, wrong way. Where are we?
We're at my home.
What's today's date?
Today's date is June 25th, 2020,
And why are we here?
for an assessment.
Okay. Now I'm going to go on with the rest of my assessment. I've raised the bed already. Now I'm going to do my vital signs, if that's okay.
That's fine.
Okay. At this time, I would do blood pressure. And then after blood pressure, I would check my patient's temperature. 98.2. Then I would check, let me see your arm real quick. I'm going to check pulse and respirations. Respiration was 18, pulse was 62, and while I'm here, I'm going to check skin turgor. Within normal limits. Not sure if I said I would do blood pressure, but at this time I would do blood pressure. My patient follows commands as well. Facial expressions are normal. Are you in any pain right now?
No.
Okay. ANO times 4. Body position is good. Nutritional status is good. Personal hygiene is normal. Now I'm going to go on to my head assessment, okay? So, head is normocephalic. Hair is evenly distributed. No bumps or lesions noted. Temporal arteries, check. 2 plus. 2 plus. Skin color is normal for consistent with ethnicity. Brain scale score is 23 out of 23. And facial symmetry is within normal limits. Gonna move on to the eyes. Before that, I will be checking pulse ox as well. I forgot to do pulse ox during vitals. 95. Now I will continue on with my eyes. Please remove your glasses. Thank you. Follows commands. Oh. Look straight ahead for me. Okay. Eyes are Perla. Now I need you to follow my pen with just your eyes, okay? Eyes Perla EOMI, and accommodation is good. So now I'm going to test your ears, okay?
Mm-hmm.
So first let me look at them, see if there's any lesions. No lesions or wounds on the ears. Now I'm going to do 3 hearing tests. First one is called the Weber test. I'm going to put this on top of your head. Tell me when you can hear it.
I can hear it.
Now I'm going to put it behind your ears. I need you to tell me when you cannot hear it.
Okay. Okay, I can't hear it.
Can you hear that?
Yes.
Okay, other side.
Okay, I can't hear it.
How about now?
Yes.
Rhine and Weber test are correct, or within normal limits. Now I need you to cover one ear. I'm going to do the whisper test. Repeat back to me what I just said, okay?
Okay.
Ice cream.
Ice cream.
Now cover the other ear for me.
Chocolate.
Okay, hearing is all within normal limits. Weber, Rhine, and Whisper all within normal limits. I'm going to check your nose. I need you to look up for me a little bit. Thank you. Septum is midline. Now I need you to cover one nostril and breathe in. Other nostril. Patency is normal bilaterally. And then I'm going to check your sinuses. Tell me if there's any pain or discomfort where I press, okay? Anything?
No.
How about up here?
No.
No? Okay. Sinuses are normal. Now I'm going to check your mouth real quick. Open up for me, please. Say ah.
Ah.
Okay. Lips, tongue, gums, teeth, buccal mucosa, tonsils are all within normal limits. And then I'm going to check your neck, okay?
Mm-hmm.
Lift up for me a little bit. Trachea is midline. Thyroid is normal. Going to check your carotid arteries. Two plus. And then I'm going to check your lymph nodes, okay?
Mm-hmm.
Pre-auricular, post-auricular, occipital, jugulo-digastric, submandibular, submental, cervical chain, and supraclavicular. Next, I will be moving on to my respiratory exam. I need you to lean forward for me. Thank you. Go ahead and breathe in and out for me. Posterior sounds are clear. Respiratory effort is unlabored and easy. No use of accessory muscles. And anterior sounds are clear. No cough, no wheezing. Or posterior, not anterior. Anterior is what I'm checking now. Anterior sounds are clear. And then I will be on to my cardiac. And then also skin color is normal around the lips, so there is no oxygen deficiency. Okay. Apical heart sound is normal. Heart sounds are normal with diaphragm. Checking with bell now. Heart sounds are normal, no extra heart sounds. Apical pulse rate rhythm is normal. Now I'm going to check the rest of the cardiovascular system. I need to check for JVDs. Can you tilt your head upwards for one side for me? No jugular vein distension. No jugular vein distension on bilaterally. I'm going to check your capillary refill reflex real quick. Less than 2 seconds. Could you put your feet up here for me, please? Thank you. Okay, so now I'm checking pre-tibial edema. No edema. No edema bilaterally noted. Checking post-tibial pulse. 2+. 2+, and then dorsalis pedal pulse, 2+. 2+. Did I forget? I think I forgot temporal arteries. I'm not sure, so just going to do them again. Temporal arteries are also 2+. Okay, that's all I needed to do for the assessment. Is there anything I can get you to make you more comfortable?
No.
Are you in any pain at the moment?
No.
Okay. Then I would lower the bed here. Do hand hygiene as I leave the room. Thank you for bearing with me.
No problem. Thank you.
And then I would go do my reports. So my report, upon introduction, patient seemed calm and collected. No extraneous body movements. Body symmetry was normal. No obvious deformities upon first inspection. Patient's facial expressions were normal. Was alert and oriented ×4. Stated no pain. Followed commands. Speech and hearing upon first inspection were normal. Personal hygiene was also normal. Vital signs were 9 for temperature, 98.2, 18 for respirations, 62 for heartbeat. No, I did not take blood pressure. Oxygen was 95. Skin color was consistent with ethnicity. Temperature was normal. Turgor was normal. Nutritional status was good. Skin was free of any lesions or incisions. And Braden's score was 23 out of 23. Head was normal cephalic. No obvious deformities on the head. Temporal arteries were 2+. Hair was evenly distributed and facial symmetry was normal. Eyes were perla, EOMI, and accommodated well. Ears, no lesions on the ears were noted. Weber, Rhine, and whisper tests were all within normal limits. Nose was patent bilateral. Septum was not deviated. Sinuses showed no pain or discomfort when palpated. Mouth, lips, teeth, gums, lips, teeth, gums, mucomucosa, tonsils, and tongue were all normal, within normal limits. Neck, trachea was midline. Thyroid was within normal limits. Carotid arteries were 2+. Thyroid was within normal limits. Lymph nodes were also within normal limits. Respiration was easy and unlabored. All breath sounds, posterior and anterior, were clear. No signs of cough or wheezing or mucus. Skin color was normal, so no oxygen deficiency was noted. Cardiovascular system, apical pulse was regular. Heart sounds were within normal limits. No extraneous sounds were heard. JVDs non-existent bilaterally. Capillary refill was less than 2 seconds. No edema noted on bilaterally on pretibial area. Posttibular pulse was 2+, and dorsal pedis pulse was 2+.